Hello, everyone. Welcome to another special webinar for our students from LAM. We continue with deep pulses, and this time we focus on the hidden pulse, or fumai, or the very deep pulse. So the deep pulses are the following. We shall take up each one by one. The deep pulse, we took that up last time. Then the hidden, the weak, and the firm. So next week, it will be the weak. The hidden pulse is only evident. You can only feel this when you apply heavy pressure. So when you say hidden, nagtatago, conceal, nagko-conceal, no? And it is only when you finally reach the bone that you get to, you get to feel this. So you have to really feel the bone, okay? I have patients who are like this. You really have to grope deeper talaga. So what does the hidden pulse signify? So since it's hidden, so that means it's so deep. So it indicates that you have stagnation in the interior. The pathogens decided to stay behind interiorly, no? Or there could be syncope, which is temporary loss of consciousness, and extreme pain. Yun. It is caused by internal hidden pathogens, syncope due to counterflow and disorder of chi movement, pain due to chi movement retention or vessel chi lacking in diffusion and free flow. So if you're interested with this one, so this is the hidden. It's also called a very deep pulse. No? This is more extreme than the deep pulse. Okay. This will only be felt, as we mentioned earlier, um, when you are able to, reach the bone. So you have to press your fingers down firmly. So it is much, much deeper than the deep pulse. Okay. And then you concentrate on your fingertips. Then you have to differentiate between a feeble and a forceful pulse, as usual. So even if it's hidden, you will also see patients with a forceful or excess and a feeble or weak. So the diagnostic significance of the hidden pulse is the same as for the deep pulse, but this is more extreme and more serious. Okay. So patterns of imbalance, stagnation, or extreme yang deficiency. So typical combinations, hidden pulse, forceless or without strength, severe yang deficiency or chi deficiency. Hidden and forceful, severe stagnation in the interior. Hidden and rapid, internal heat. Hidden and slow, internal cold. So somehow you should be able to institute the correct treatment in order to effect a pulse, a change in the pulse. Okay? So when we get the chance to meet, I'll teach you how to do it. Okay? And you could really see the smile on the patient's face when you're able to, when he or she is able to determine, ay, nag-iba yung pulso niya. No? Hmm. So let's make, let's make it more meaningful, no? So that in the future, these patients will only look for practitioners who can actually um, effect a change in the pulse, kahit temporarily. Okay? The pulse cannot be felt when you just touch it or when you're seeking or pressing. Only by pressing very heavily to the bone can it be felt. Okay? So it seems like it comes from beneath the tendons and the bone. Okay, so let's discuss the indications of the hidden pulse. So for pathogens obstructing the interior, so that means it's forceful, okay? Contrasted with this one, like when the patient had a syncope, temporary loss of consciousness, no? So with if the hidden pulse is strong, That means there are excessive pathogens that obstruct the qi and the yang. The qi and blood cannot flow to the exterior or the superficial portions of the body through the vessels. So in syncope, this is like the hidden pulse with a very weak pulse or forceless pulse. The yang is too weak to push the qi and blood to flow outward to the exterior. So in biomedicine, this is um, the counterpart of cardiogenic shock. So that means if this is very serious, you need to really bring the patient to the hospital or schedule an appointment with the cardio. No? Toxic dysentery, profuse hemorrhage, and severe pain can also give rise to hidden pulse. So if the pain is relieved, then you are able to feel the pulse now, even without pressing too hard. No? It is caused by a dramatic reduction of blood volume, resulting in a fall of blood pressure. During pregnancy, a woman may have a hidden pulse, okay? And that is not a good thing, no? In the absence of other signs and symptoms, this pulse would not indicate any pathological changes. But again, you need to be cautious lang talaga. And try to make sure na bumalik sa pulse. Okay. So again, here you can see the illustration of the hidden pulse. If you remember, we have the middle and the superficial, and I believe that you know the significance of feeling the pulses on these levels, no? So this pulse cannot be felt until after you apply deep pressure to the level of the bone. And even then, the beats seem to come from beneath the tendons, okay? Whether the beats are distinct or indistinct, they can only be felt at a very deep level. So again, the hidden pulse is deeper than the deep pulse. The deep pulse is also known as the sinking pulse or the submerged pulse. So the hidden pulse is caused usually by perverse cold obstructing the Jingluo or Zhangfu. It can be caused by external cold blocking the channels, preventing the yang qi from surfacing, in which case it disappears as soon as the yang qi clears the cold and produces perspiration. It can also be caused by yin cold accumulating internally. There are cold sensations. So if you try to palpate the area around the navel, there will be cold sensations, or the limbs may be ice cold. Okay? Um, so when you're able to feel this on these patients, expect a hidden pulse. No? Less frequently, it is caused by perverse cold that generates heat. This happens when the internal stasis of the perverse qi blocks the jingmai, obstructing the blood and qi. So, the hidden pulse can appear in cholera, frequent vomiting caused by food accumulation, or in intermittent abdominal pain caused by phlegm stasis. Any disease in which vomiting and diarrhea occur together traditionally was called cholera. This does not necessarily correspond to the modern usage of the term. Such diseases now are usually caused by food accumulation. Yang heat is subtracted externally and yin cold is hidden internally. In these cases, the internal warming, cold scattering technique to increase the flow of blood and qi, thereby clearing the accumulation or counteracting the stasis and dissolve the phlegm. Now for the Tun Quan Shi. When food stagnation causes discomfort in the chest, or qi stagnation causes nausea with inability to vomit, the hidden pulse you can feel on both chun positions. Okay? So consider a patient who is nauseated now, and then with discomfort in the chest. Now, when the cold dump accumulates at the middle heater, causing laziness and abdominal pain, you will now be able to feel the hidden pulse in both quan positions. Then when accumulated cold qi blocks the lower heater or lower burner, causing extremely painful hernia, you can feel the hidden pulse in both shi positions. Any questions before we ask you questions? Mom Tricks, do you have any question?
No, Doc. None.
Okay. So I hope everyone was able to get uh, or try to familiarize themselves with the hidden pulse, which is also known as the very deep pulse, or then compare it with the pulse that we studied last week, the deep pulse or the submerged or sinking pulse. So this one is just an extreme version of the deep pulse. Okay. So who would like to join us in the assessment? Can you do the honors, Madam Madam Trix?
Okay, Doc.
Sige. Kasi parang kinareer mo na tong pulse eh.
No, naman.
Okay. Please tell us the characteristics of the hidden pulse. This is just a
Mm, the pulse can be felt by pressing hard to the bone.
okay. So if you do not press hard to the bone, you will not be able to. It's hiding nga eh, no? Hidden pulse. Next,
Mm,
what is the key point in the hidden pulse? Like the thing that will make us remember it.
it is very deep, deeper than the deep pulse.
Wow. Location of the hidden pulse.
To the bone.
Okay. When I say the power level, you have to compare this with the normal pulse. So how do you describe, would you categorize or assess the power level of the hidden pulse?
It is significantly less power than the normal pulse.
Okay. What are indications of the hidden pulse?
Um, Cold syndrome. The excess case is slow and forceful, and deficiency, it's slow and weak. Then the slow pulses can be seen in healthy persons, especially athletes. Athletes.
Mm. Or on medications, no? Especially mga beta blockers. Cold syndrome, excess case would be slow and forceful. Deficiency case is slow and weak. Okay, let's analyze the hidden pulse.
Uh, the chi stagnation is due to cold. It impedes the yang qi and blood circulation. For the explanation will be cold has the tendency to constrict and contract. This affects the blood flow and thus impedes the blood circulation, resulting in the slow pulse.
So the main culprit here is the cold, no? So which has interiorized talaga. Okay, so when you have cold, this will definitely impact the qi and blood circulation, the yang qi. Okay, and we all know that cold can constrict and contract. Okay, so this will affect the blood flow, and so that's why you have slow pulse. So this, yeah. So the only thing that will make us is to differentiate whether it's forceful or um,
Weak.
weak. So for a patient who had syncope, temporary loss of consciousness, can you describe the hidden pulse that you would expect?
Syncope. It's slow and weak.
Okay. Now let's talk about the deficiency, no? Kasi we all know that cold naman is ano. So uh yeah, so just like the syncope, that's an example of deficiency case. Can you tell us, can you help us analyze the hidden pulse there?
So it's caused by the deficiency of the vital chi being unable to reinforce the pulse.
Okay. So every time you have a deficiency condition, it actually has something to do with being unable to move the blood, no? So for someone who had temporarily lost consciousness, we obviously have a situation in which that yang qi is very, very deficient.
Mhm.
Okay, for the last three questions, these are all related, no? So if you have hidden pulse on both right and left soon, okay? So you examine the patient and then, di ba, what particular organs are we talking about here, madam?
Or, ano ba yung sagot ko? The chi stagnation in the chest, food retention, and manifest dry vomiting.
Yeah, pero what organs are we talking about? Yung sa,
Uh, for chi, a liver
no, no, no.
and
Soon ito, ha? The soon. But soon, Quan, sure.
uh,
Oo. Ano yung mga pulse,
uh,
like what's,
uh,
hmm,
heart and lungs. Ano ba?
yeah, heart and lungs.
Heart and lungs is
Mm,
liver and
why would we expect food retention in a person with like, why do we consider this a tune, yung food retention?
the
Because the lungs have something to do with the spleen.
um,
When you have food stagnation, food retention, you also blame it on the inability of the spleen to transfer. And we all know that the lung and spleen are both, ano nga yun? Um, tie-in, di ba? Tie-in. Remember? Mm. So,
yes.
the hidden pulse, so we expect the pulse to be very slow and very deep, of course. So when you have chi stagnation in the chest, food retention, what type of hidden pulse will you expect? Forceless or weak? A forceless or forceful?
Forceless.
Oh, no. Wait lang. You
Stagnation. Ay,
lie.
wait.
Chi stagnation in the chest is not a
Not
deficiency.
deficiency, it's excess.
So
Forceful.
question. Forceful. Okay. So imagine mo you're in front of the patient, you're feeling the pulses, the tune, and it was so difficult to find the, like, so you need to really press hard, di ba? Press
To the
ka talaga
bone.
till you're able to feel the bone. And then you find when you finally felt the pulse, um it's ano ba to? Forceful. So what will you be asking the patient?
If she,
Imagine mo ha, sa tune ka muna, sabi mo sa lung and heart, right? Left sa you could have benefit yung mga bago, baka masiraan na ba? You know, it's so fun. Like you need to ano ha kasi I'm really serious because we need to learn this together. Kasi this is
mm,
for me a barometer of your skill, 'di ba?
mm,
Hindi mo pinulsuhan. Kasi darating ang time the patients will only look for those who
can do pulse and tongue.
in my experience, it's so difficult, especially if you don't get to read about it, right? Yun. At saka minsan you're able to feel something na sa, or we need to master the art of really determining, like nakita mo putlang-putla yung at ang lamig-lamig ng mga paa, kamay. So you might already consider, na biglang inimatay, no? So you might be considering, hidden pulse that is very, very, very weak. But
Weak.
this time, yung pasyente mo is so wide awake. Lakas ka,
Mm-mm.
mukha ang lakas kumain. Di ba?
There, uh, there's pain in the chest. Probably.
Stagnation. Yeah. So probably what you might ask, do you have like the experience parang heavy, ano ba tawag di? We call this stifling sensation. Parang inano siya, 'di ba? Can you imagine? The patient would be so happy. Ay, paano mo nalaman? 'Di ba? And then another possibility,
Doc, yun ba yung parang heartburn? Yung pain?
hindi naman.
Not necessarily.
That would be ano na rin siguro like duller than the heartburn. Duller. No? I don't know, huh? Pero I don't think it will be as bad as that. And at the
Uh-huh.
same time, when you look at okay, ito, para malaman natin, you will have to look at the tongue. Okay. Let's say merong food retention. Tapos na feel mo, baho-baho ng hininga. So, what do you expect to see on the tongue?
Um, a white,
Dry tongue.
white,
Will you be able
white
to
thick
expect a thick
coating.
thing? Yes.
Thick coating. It's
Will it
white.
like white? Okay.
It's white. Kasi cold siya.
Dry vomiting. What do you mean by dry vomiting? The patient just feels nauseated.
Parang lumalabas na, there's no,
Okay. Nice, diba? Now let's go to the next one. The Kwan is the middle location. Yung Kwan. Okay, chinek mo ganon. Um, what do you expect to to kasi 'di ba, like let's face it, if it is excess, you will be able to feel it right away, 'di ba?
Yes. Yes.
So, like, what is your here? What would be your working diagnosis?
there would be, dull abdominal pain.
Yeah. So,
No.
okay, dull abdominal pain. Remember, we have the liver on the left, then we have the spleen on the right, 'di ba?
Mhm.
The moment medyo matigas na yan, you'll be looking at the stomach already, right? So dull abdominal pain due to liver restricting the
Liver
spleen. So what particular five-element relationship are we looking at here?
Uh,
Anong nangyari?
metal,
Bakit
metal,
nilip na yung stomach?
ano yun? Insulting. Si spleen insulting the liver. Tama ba?
Ay, hindi no. Over
I
control.
think
Do you agree? Do
over-controlling.
you, si ano ba to? Si M. Okay. Hello, Sir Mark.
Mark.
Can you help
Ayan.
us?
Hi, Sir Mark.
Si Sir Mark. O, tulungan mo kami. Ang pulse niya hidden sa Kwan positions. And sabi ni Madam T, it can be due to dull abdominal pain, due to liver. So obviously this is not weak, 'di ba? Do you agree? Forceful siya, 'di ba?
Forceful
Forceful
abdomen.
kasi over-controlling na nga eh. So liver
Over-control.
restricting the stomach, no? So ibig sabihin, yung stomach niya, hindi siya natutunawan siguro. Hindi siya diba?
Hindi na tinam.
The stomach, what does the patient feel? Would he like to throw up or would he like to poop?
Ano, parang burping. More
Yes.
like
Nag-aano
burping.
siya. Oo. So pag humina ang
Gassy.
stomach kasi, it goes the opposite route instead of going
Mm,
downward, no?
yes.
So, ano kaya ang possible scenario dito? Like when you have liver restricting this is basically wood um,
Over-control.
over controlling the earth, right? So, ano ba ang most common reason why the liver becomes so over-controlling.
Chi stagnation.
Yeah. Emotions, diba? Emotion.
Um,
And then finally, mm, hidden pulse sa shear, no? Sa kidney yin, kidney yang, di ba? Then sabi natin kanina, when you have hernia, no, masakit, or there is severe pain in the lower abdomen
severe pain. Mm, mm.
caused by,
Caused by deficient cold.
what is another name for deficient cold?
Uh, yin.
No, 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 no. That's deficient heat. It's time na master nyo na yan.
Kalimutan ko na. Deficient.
The reason why it's called deficient cold, cold siya kasi kulang sa something.
Kulang sa yang.
Deficiency
Kulang sa,
yung
so this is young deficiency. Yeah,
C.
yeah. In pain, severe pain na to ah. Severe pain in the lower abdomen. What do you expect to see sa tongue? Would you expect
Swollen.
color of the tongue?
So,
Right? Severe
pale.
pain. Ano kaya
Pale.
tongue na?
Severe pain.
Especially sa
Swollen.
Baka
kulay.
purplish.
Purplish. Wow.
Purplish.
Purplish.
Okay? So obviously, because of the cold, nag-stagnate na yung blood, di ba? Oo. Ay, so na pasyente mo, Doc She.
Yun, may ano yun siya.
Okay. Would you like to share your patients with us? O sige, tapusin na
Hindi.
natin to. Thank you so much, everyone, for joining. Especially
So,
for really sharing with us your thoughts. No? Maraming salamat po.